Hello, I'm Susan Moore, and I'm excited for you to meet Dr. Richards. He's with the Cardiovascular Institute, a cardiovascular surgeon, and you're pretty much in charge of the vein clinic, even though you won't admit it, right?
Not really.
Okay, so typically, Dr. Richards, who is your patient, or is there a typical patient?
There is, actually. We tend to see more women, mostly because women have the babies. And that is one of the risk factors for varicose veins. The other thing that we see is people who tend to not be so athletic, but may have been athletic at a younger age and had injuries to their legs. We see those folks as well. But normally our patient is an older woman whose mother happened to have varicose veins, and they have followed suit and have varicose veins as well. They usually have had more than one child. And as they've grown older, and the fact that we walk upright puts a lot of pressure on our lower legs, and so as a result, they typically have varicose veins below their knees.
Okay, well, I want to come back and talk about that too, but are the ways you treat varicose veins, have they changed from mom's varicose veins much to how today's women?
They really have, Susan. Yeah? And the reason for that is when back in the dark ages, when I first started practice, the way we would take care of varicose veins is by stripping them. And the way you would do that is you'd make a little incision at the ankle and an incision in the groin, and you'd run a plastic or a wire up the vein, and then you'd put a stripper on the end of it, and you'd find the largest intern, normally orthopedic interns were the ones that we would gather, and they would pull as hard as they could at the end of from the end of the bed, and then we would wrap the leg as we go. The problem with that technique, it's very effective. It certainly gets rid of the vein, but the problem is that we would have the patient would not walk normally for probably a month, month and a half.
Wow.
And so they were kind of laid up, and if you had a regular job, then you would end up not, couldn't do your job for 4 to 6 weeks, and they lost a lot of time away from work. Now we use a laser, and we make a small puncture site actually somewhere around the knee, and using the laser, the heat of the laser causes a thermal injury on the inside of the vein, and as a result it closes off, and it takes all of the pressure off of those varicosities, the ballooning veins below the knee. And they're up walking around the afternoon of the procedure, and back around their usual activity the following day.
So would you say it's mostly for the pain, or is it mostly for the cosmetics, or is it some of each?
Well, there's a variety of problems you can have with varicose veins. One is they hurt.
Yeah.
The other is they can bleed. And you can get ulcerations around the ankle, particularly on the inside of the ankle from the varicose veins. And so there's a medical aspect to it, certainly, to get rid of those problems. But one of the nice side effects of this operation is there is a nice cosmetic result, usually, in that instead of having these big bulging veins in their lower leg, they go away and their legs appear normal from a distance. Now, I won't tell you that we give them 18-year-old legs again, because if I were to tell you that, then I would certainly end up with a lot more patients on our doorstep. But you do have a much nicer cosmetic appearing leg after the procedure.
And how does that vein become bulging to begin with? You said having babies?
Well, when we were put together, and we decided to walk upright. My wife would still consider me knuckle dragging, but the problem is that when we started walking upright, in order to get the blood back to our heart, your heart squeezes and a pulse goes out, and so blood goes down and then comes back, right? And the problem is there's a period where the blood's not really moving, and for that reason there's valves in your vein. And as you age, those valves, either from the increased pressure of having a baby in the pelvis, or just the fact that you have a tendency to do that, those veins dilate, and so the cusps of the valve cusps in the vein don't meet in the middle anymore, and so you have a big long column of blood pushing on the vein, which is a thin-walled structure. In addition, in your thigh, you have a sheath that sits around that vein. So that's why you say, well, why aren't there more varicose veins in the upper leg? The reason for that is there's a sheath around the vein in the upper leg, and the lower leg, and that sheath goes away about the knee. And so in the lower leg, there's nothing to keep those veins from distending. And so you have that big, long pressure head on a very thin-walled structure. And so as a result, it dilates up. And once, from blowing up balloons as a kid, you remember the hardest part of any balloon, blowing up any balloon, is getting it started.
The beginning,
right.
yes.
And once it starts, it will dilate a lot more quickly. And so that's how that happens.
Okay. So your patient usually comes to you in pain?
They come. Usually they come. Well, one of several. Our practice has been we get sent a lot of people from the wound clinic because they have wounds in their leg. We've had people who've bled from their varicosities, and then we do have a few folks that just have large veins and they're unsightly. And at the end of a working day, particularly if they have a job where they stand all day, their legs ache. And so those are usually the people that we see. Again, occasionally we'll get some patients that will come in for purely cosmetic reasons, but we don't see very many of those here at NCMC.
Okay. Well, thank you for making legs more beautiful. That's certainly delightful.
It's a good thing.
It is a good thing. Is there anything that you'd like to add that we haven't touched on at the Cardiovascular Institute? Being a cardiac surgeon, the signs that we should look for that our veins might not be healthy, or will they just tell us through pain that they're not?
Well, bleeding usually gets everybody's attention.
Okay.
And if you have an ulcer on your ankle, that usually gets people's attention.
Yeah.
But usually it's just the large bulging veins. And one of the other things that we've had people come in with is, have you heard of restless leg syndrome?
Yes, I have.
Okay, well that can be a symptom of varicose veins.
It can be.
So as a result, those folks we've had some referrals for that as well. And quite honestly, once we take care of their varicosities, their restless legs, for whatever reason, seem to get better. So anyway, yes, they can call 970-378-4100, and we will set up an appointment. Which the nice thing about the screening that we would do, if you have a concern about your legs or you want to know what can be done for them, the nice thing about the screening is it's free.
Oh, that's very nice.
So the price is right, and we screen and see if there's a problem that we can fix or address, and we do a screening ultrasound to see if there's what we can do, and if it's amenable to the laser procedure. So again, it's free. It takes them about 15 minutes to do, which is not a large investment of your time. And again, when it costs you nothing, I think that's a good way to get in to see healthcare.
All right. Well, you've been delightful. Thank you so much. Dr. Richards with the Cardiovascular Institute, cardiovascular surgeon, and just all-around fun guy. Thank you
Well,
so
thank
much.
you.
Sure.